Hi, my name's Cassie. I'm a physiotherapist at Comox Physiotherapy in beautiful British Columbia, Canada. My passion is helping people find healthy movement to improve their quality of life, whether that means being able to garden without pain or running a marathon. I hope these videos are helpful. I made these videos with my patients in mind, people whose exercise programs I'm already supervising. So while I am a physiotherapist, I may not be your physiotherapist, and if I'm not your physiotherapist, the following applies. Please be sure to consult with the appropriate healthcare professional before beginning any exercise program because you could hurt yourself. Now with that out of the way, let's begin. It'll be fun. Hi there, welcome to another edition of Healthy Movement with Physio Cassie. Today we're going to look at some techniques for increasing range of motion in the ankles, mostly weight bearing. Let's get started. So first things first, how can you measure your own ankle range of motion at home so that you know that what you're doing is helpful? Because it's often difficult to figure out, am I doing something right? Am I doing it wrong? Is it helping me? Is it hindering me? So this next demonstration shows you how to measure your own ankle dorsiflexion range of motion reliably at home. So normally the first step in this process would be to put a piece of masking tape on the floor, but unfortunately the only masking tape that I can find is this really old masking tape that is tearing really badly. So I'm going to modify my procedure. Having said that, if you have masking tape at home, some painter's tape, you put a strip of it on the floor perpendicular to your wall, and you'll get a sense of what I mean by that and how it works in just a second. So what I ended up going with was a piece of laminated paper on the floor that's just tacked in position. You need something to measure with, and you need something to mark your tape or your piece of paper. So going back to this idea that it's my left leg, what I'm going to do is put my foot on the ground close to the wall. The heel stays down on the ground and the foot needs to stay straight. So you're just going to bend the knee and touch the wall. Now that was pretty easy for me, so I'm going to move my foot back. I'm going to try again. Still pretty easy. So I'm going to keep moving my foot back until I find that place where I can barely touch the wall without my heel coming up. And that's about my spot. And my paper moved, but let's pretend we're using tape. So then I'm going to mark it. And I can move my foot. And then I can measure it. Now, in this case, I have a baseboard to contend with. So my baseboard adds about 1 centimeter. So I'm going to add 1 centimeter to my measurement. So I measured out at 11 centimeters on the ruler, which makes it about 12 centimeters in real time. So normal for this is 10 to 13. Can I do it backwards? Yeah, 10 to 13 centimeters. So if you're in this range, this 10 to 13 centimeter range, you're within the range of normal. If you're not in that 10 to 13 centimeter range, if you're above that, flexibility probably isn't your problem. If you're below that, flexibility is definitely your problem and you need to work on it. So the exercises within this video are going to help you work on that flexibility, and this test can be a way for you to check in periodically to make sure you're doing the right thing. Hopefully you've had an opportunity to measure your flexibility by using the wall test that I demonstrated in the earlier part of this video. It is helpful to use the wall test to figure out where you are, and so that you can also reassess after you've done your self-treatment to get some affirmation that what you're doing is helping your range of motion. It's also very helpful to have something to check in so that you know over time that you are improving, because often it can get frustrating when you feel like you're just not getting anywhere. So the first step in your routine for increasing your mobility should be to release your calf muscle. So I'm going to use a foam roller, but you could use anything. You could use a pool noodle, you could use a wine bottle, you could use a rolling pin, any of those things will work. It is very helpful to have the roller on top of something that's elevated. A footstool is perfect, but you can put it on top of something else that's even a little bit higher, but usually the footstool is kind of the best height. So if I was working my left calf, I'm going to put my left calf up here on the foam roller, like so. And now, for me, I can already feel some little knots and things in my calf. I'm just going to roll, roll, roll. Oh, there's a knot. Now you'll notice that my foot is totally relaxed. If your foot is flexed, if you're pulling your toes up towards your nose as you're doing this, you're not going to feel very much because the foam roller is not going to sink into the tissue. So you want to relax the foot, roll back and forth until you find a knot. There's one on me. And then you can pull your toes up and you can release. And pull your toes up and release. And you do that about 10, maybe 15, maybe 20 times. And then roll around a little bit more. Find another spot. Oh, there's another spot. And then there, pull the toes up and release. Now, if you're not getting much feedback doing it this way, you can increase the pressure by putting your other leg on top. And it's the same procedure, so now I'm just going to roll, roll, roll. But again, so for me, my calves are actually very sensitive. This is a little bit too much input. So I wouldn't use this technique, but just to demonstrate, there it is. And now I found my spot, so I'm going to pull my toes up and I'm going to release. I'm going to pull my toes up and I'm going to release. So you might work the calf like this for a couple of minutes, trying to find as many little tight spots as you can. That's going to get your calf muscle to let go a little bit before you try to do the next exercise. So the next exercise is a great way to self-mobilize the ankle joint and also improve that calf flexibility. If you have a rolling ball, it's perfect for this. If you don't, I will show an alternative of how you can just use a regular chair. So feet are here, and what you're going to do is roll forwards until you get full stretch on your calf with your heels down on the ground, and then come on back. Roll forwards. That's a nice full stretch, and then come back. Roll forwards and come back. And you would do that for about 5 minutes. I'm going to put timing and that sort of thing down in the comments or in the description for the video. So if you did not have a rolling ball, you could use a chair as long as you could get your feet underneath you. And what you would do is you put your hands down, slide forwards, and then come back. Slide forwards, and then come back. It's not as effective as the ball, but it does work. So now we're going to do, so we've done self-mobilization, which is a rhythmic in and out for several minutes. Then we're going to do a nice long sustained stretch. So I really like to use a wobble board for this. So I have my wobble board here, but you could just set up a piece of plywood with something underneath it, or even a binder set up, and then you're just going to put your feet in this position, like so, until you get a little stretch. You can lean on your heels, and you just hang out here for a while. And by a while, I mean 2 to 5 minutes. So that would be your full routine for regaining ankle dorsiflexion with the knee bent. Now, it's also good to get ankle dorsiflexion with your knee straight. So if that's required as well, then we would just stand up on our structure. And it should feel like a pretty good stretch in the calves. Now, this is a pretty extreme position. It's about 20 degrees. If you couldn't do 20 degrees, you would just lower the upper angle of your board. Or you could, if you had a wobble board like this that wasn't adjustable, what you could do is you could put down a towel or something underneath the wobble board so that as it tipped, it would not go as far. So that's a nice little routine that is partial weight bearing to weight bearing to increase dorsiflexion of the ankle. That would be done approximately twice a day if you had restrictions. Drop, roll point, drop, roll point.